Good afternoon and welcome back to this teleconferencing session. We shall be discussing about the same block 3 as we have discussed in our previous session, but the unit will be unit 2, that is on evaluation of nursing care. To discuss this session we have same faculty members here, the same experts, that is Ms. A.T. Kora from St. Stephen and Ms. Lakshmi from Lecturer School of Nursing Health Sciences. Ms. Kora, we have in previous session we have discussed about and given a detailed account of quality assurance, but how do we ascertain that whether the quality assurance has been maintained, or what steps could be taken to maintain and ascertain the quality assurance? What is that we can do for assuring the quality and sustaining the quality assurance?
When we say the quality assurance, evaluating the whole nursing care is what is making the difference of quality of nursing care. So we can say that evaluation is a process in the management system. When we say it is a managing process, it's a part of management process, we mean to say in quality assurance also some amount of planning is required, some amount of organization is required.
Yes, please. Yes, Jammu, please speak. Yes. Yes. Jammu, please speak up.
That we have 7 academic counselors with us. Hello.
Hello. Yes. Yes.
Along with the program in charge of Madri Mehban Institute, where we have this DNA program activated, and all these are keenly watching the program, taking out notes, and they will have questions which they will send through a fax or interact. Thank you and over.
Okay, thank you. Thank you, Jammu, for your response. Ms. Kora, will you continue the session?
Yes, ma'am. The planning, because every step what a nurse does requires planning. Whether it is bedside nursing, planning is required. The organizing is a process which is based on the planning and directing. A ward in charge who is planning for that particular ward's functioning, she organizes the thing according to the requirement, and then she directs each and every member of her team, and she is responsible for controlling the entire process. And evaluation is done by various people. A nurse who is doing the bedside care evaluates her own work. A ward in charge evaluates her team's work, how her ward is functioning. A supervisor evaluates the function of her entire team. A nursing superintendent evaluates how her entire team of nurses are functioning. So the entire process is based on how the standards are laid down and how we are able to measure each of the standards, and then we are enforcing corrective measures. That is, we identify the non-conformities which are based on the evaluation what we do. Now, non-conformities can be identified only if we know what are the correct things what is to be done. In other words, we can say that what are the set standards. Once we know the set standards, then we are able to identify what are the conformities or what are the correct things based on the nursing standards, and what are the things which are not correct or the non-conformities. The non-conformities need to have the corrective measures for meeting the laid down standards. That means in a bedside nursing care or in running of the ward or in running of a hospital, there may be certain things what we need to make changes in the system. It may be providing some things like, if for patient care cotton is required, it is not available for the use. Say for example, for cleaning the area for a particular procedure, spirit is required, it's not available. Providing that thing becomes the responsibility of the ward in charge. Likewise, from small thing to big thing, we identify the conformities and non-conformities. So in other words, we can say that it becomes as the management's entire responsibility, or it becomes as a process of management when we say it is quality assurance. When we are evaluating the quality of nursing care, high quality of care is guaranteed by developing set standards in nursing care, and nursing evaluation of tools are prepared. Now when we say evaluation of tools prepared, one, I have already told about patient satisfaction scale. Other than that, if you want to know how a particular nurse is functioning, you can prepare a certain evaluation form, like one particular patient, how the patient's personal hygienic needs are met, whether the patient is continuing to have tangled hair or not, whether the patient's eyes are remaining dirty or not, whether the patient's urobag is emptied on time or not, or it is having urine collected for the past 12 hours or not. These are some of the things based on which you can evaluate the care what is given by a particular nurse. So when we say nursing evaluation tools are determined for the assessing the level of care provided to the patient. Now evaluation tools can be varied, and this particular performer may not be required if you are a good observer. If you see that as a supervisor your patients are remaining dirty, that means patient's care is not given properly. And when we say there are major functions of evaluation in nursing service, that is ascertaining the nature and effect of nursing care. From patient to patient, the nursing care is varied. When we say patient to patient, the nursing care is varied. The prime important thing is our patients are separate individuals. They are not diseases, they are not bed numbers, but each individual patient is different from the other. Deciding whether or not the observed effects attain acceptable standards of nursing. Identifying the patient as a separate individual is the first and foremost thing. And other than, based on all this evaluation, we can say that the evaluation itself in nursing care can be defined as the combination of objective measurement of concrete phenomena as well as subjective perceptions and opinions of the feeling of care as reported by patients, providers, that is nurses, and important others. Now whom all we can include in important others? Patient, patient's relatives, and the treating doctors. Providers, when we say in a patient care, in a nursing care, providers are the nurses. Now nurses, when we say, who all are involved? Directly from nurse administrators to the person who is giving care to the patient at the bedside. And if we see why evaluation is important, we can see that it is primary concern of a staff nurse is humanitarian attitude towards the patient. As I have said already, a patient is a person. Patient is not a bed number or not a diagnosis. Very often when you walk into a ward, you can listen a sister or a staff telling bed number so and so, or a patient that patient with hepatitis, or that patient with such and such diagnosis. That is a wrong way of addressing the patient. Why I am telling it is a wrong way? Because when we are having the humanitarian approach, we go to the patient, we identify the patient with his or her own names. Then the hospital buildings are to be free from hazards, and it need to have equipments and other things which are giving enough comfort to the patient. If our patients who are staying in the hospital is not comfortable, we can't say that we are able to give quality care. That is not possible. Then everything what we need to do for the patient need to have scientific principles based on. In other words, we can say rationalization is something what is needed. If you are doing the bed making in a particular way, or if you are giving medicine in a particular way, we need to know why we are doing it. When we know why we are doing it, then we are able to go ahead towards achieving the quality. Then we are able to display fundamental principles of good management. If quality is based on what our patient satisfaction is, then we can say that the care is based on the fundamental principles of good management. And above all, but the importance of evaluation includes, as it is sufficient number of qualified nurses for performing the satisfying of physical, mental and spiritual and emotional needs of all the patients. Very often physical needs are met, but we overlook the psychological needs, the emotional needs, social needs and the spiritual needs. And this often happens when we are forgetting that patient is an individual. When we see the patient as a bed number, we forget that the patient is having the needs. When we are realizing this, our evaluation techniques also will be varied.
Can you give some concrete definition of the evaluation?
The evaluation is a process which is recurring interactions and not the just actions, but much more than that. The nursing evaluation, when we say it is nursing care, a combination of both objective measurement of concrete phenomena as well as subjective perceptions and opinions of the feelings of care as reported by recipients. Recipients are the patients, providers are the nurses and important others. This is according to Bergman. This is the nursing care evaluation definition.
Okay. Lakshmi, she has already discussed about the importance of evaluation, and while planning for evaluation of nursing care, you should follow some of the important principles. What are those principles which should be followed while evaluating a nursing care?
For evaluation of nursing care, we have a set 10 principles which has been given by Fred Katz. Can we have a slide please of the principle? The first one is relevance. Like evaluation we are doing, it should be relevant. What assessed is relevant in terms of healthcare actions. Like if it, for example, we are using the inch tape, that is relevant to measure the length, not for the weight. So whatever evaluation tool we are using, it should be relevant to measure the any activity. Like Madam Kora has said, like we have a for eye care, whether the eye care is given and any infection is there. So that is specifically meant for eye. So that tool which we are using for evaluation should be relevant. Then second one is comprehensive. Comprehensiveness is that the assessment is made for totality of the behavior required. We are focusing on comprehensiveness nowadays, integral, like we are covering all the aspects of the care. Then problem solving. For another principle is the ability to adapt to different conditions and select appropriate action. Whatever evaluation we are doing, it should be able to solve the problem. Like we should be able to find whether the person is lacking, what all are the weaknesses, and then we should have then we have identified the problem out of that evaluation process, then we have a solution for that. So whatever we are doing evaluation, it should be problem solving in nature. Then validity. That the assessment measures what it purports to measure. It should not be like sometimes we use very lengthy performa, but ultimately the results come and it does not show the qualitative results. So the tool we are using, it should be valid and assess what it's proposed to measure. Then next is generalizability, that the measurement provides prediction to other situation. If we are assessing in one situation, it can be generalized to other situation. That tool, that technique can be used in other situation also. Then reliability, it should be reliable. Whatever tool we are using for the evaluation, the one principle says that it should be reliable. We can accept it. Then appropriateness, that the format or the type of assessment is suitable for the type of practitioner. It should be appropriate. Then effectiveness, that the predetermined objectives of the plan of nursing care are actually achieved. Effectiveness, we say when we achieve the target, we achieve our objective, then we say nurse is working very effectively, she is working very skillfully, she is achieving all her objective. So this is called effectiveness, and it is the very important component of quality, this effectiveness. All the health personnel should work effectively. Then efficient. Efficient is related to the cost, like the cost effective in nursing times as well as the material and money. Whatever resources we have and we are using those material very efficiently, that includes cost effectiveness. So it is also a principle. Then adequate. The total patient care dealt with by nursing services was adequately covered. So these are the principles given by Fred Katz, that we should follow all these principles for the evaluation.
What are the techniques used for evaluation?
If we are following these principles, you see one technique cannot work for the evaluation. As our nursing is a profession, is a set of complex activity. We are catering to the patient and we are satisfying the different needs of the patient. So proper evaluation is only possible when we are having more methods and more approaches for the evaluation. So major approach to evaluation may be classified differently. It can be short-term evaluation versus long-term evaluation. As the word indicates, it is based on the duration of evaluation. We are doing for short-term, we are doing for long-term. Like we have short-term objective which we achieve within short period of time. Like patient has come having bleeding, we have given the first aid, bleeding is stopped, and now we are doing the dressing. So our aim was just to stop the bleeding. So this was a short-term goal. And long-term goal for that particular patient, that the wound gets healed and gets discharged. So like this in evaluation also, we have a short-term evaluation and the long-term evaluation. Then individual unit and institutional level evaluation, depending upon the level at which the evaluation takes place. Sometimes we evaluate the individual and sometimes we evaluate the institution. So this is based on the level at which we are evaluating. Then formative evaluation and summative, it depending upon the aspect of service being evaluated. Formatting, like we are doing during in between also, the process is going on, we are doing in between, and the summative we are doing at the end. Summative as word indicate, and formative we are doing continuous. Okay, so these are the some of the classification of evaluation. Another method of classification of evaluation is given by Guba and Lincoln, that is classified as first generation class evaluation, second generation evaluation, third generation evaluation and fourth generation evaluation. And what is there in first generation evaluation? It is measurement oriented evaluation. Like evaluation is treated as scientific process, for example patient opinion survey. Here we are just directly dealing with the patient. We are taking the survey from the patient, we are doing nursing audit, that will be discussed in detail, and where the patient is rarely consulted. Then second generation is objective oriented evaluation. It is an approach characterized by description of pattern of strengths and weaknesses with respect to certain stated objective. Like we have a stated objective and we have to achieve those, and if we are not able to achieve those objectives, then we will see whether the health personnel is lacking. So this is second generation evaluation. Third generation evaluation is excellence oriented. And excellence, that means it should be based on standards. The evaluation includes development of nursing standards and criteria. Like nurse should follow these standards and these criteria. So this is third generation evaluation. And in fourth generation evaluation, it is negotiation oriented. Negotiation, like we have a set standard, but sometimes we are not able to achieve them as per the availability in our on working situation. So we negotiate, okay, we are not going by this way, we can achieve another alternative for this. The evaluation move beyond the measurement and it's cooperative, and this takes into consideration the various factors affecting the situation. The success of evaluation depends upon the participants' integrity, communication, peer sharing and reconsideration of values, willingness to change and commitment of time and energy. So these generation wise classification, or we can use the another classification that is short term
I think you
and
have
long term.
discussed mainly about the approaches of evaluation while talking about the first, second, third and fourth generation of evaluation. But what exactly are the tools and techniques which are used in evaluation?
Like we have like based on this system or the approaches, we have tools. We have 4 tools like patient care centered tool. In this we are mainly focusing on the patient care, and for example we'll be discussing in detail. First we can list it down. Second one is patient satisfaction measurement, third one is nursing audit, and fourth one is quality patient care scale. As in first one, patient care centered tool, patient care centered, here we are observing the patient, we are observation tool. Okay, then nursing rounds, we do the nursing rounds for the patient. Then use of standards for the nursing practice. So these are based on these are the patient centered tool. And indirect criteria which may indicate the good nursing care is being provided, that is number of errors and incidents which requires reporting is negligible. Like if we have less errors, if we have less complaints, that means that staff is giving good care. Few requests are made for the private duty nurse, that means they are satisfied with the staff which is provided by the institution. Few complaints are received from the doctor, patient and the families. If we are getting less complaints, that means they are giving quality care, good care, and they are satisfied with the patient. So these all tools are based on patient centered. For example, in observation, we observe how the patient is behaving, and in here the nurse plays the key role, because she only has to open her antennas, like she should assess the body language of the patient, how the patient is behaving. So in the observation she has to observe. In nursing round, which we do takes place, staff nurse and the sister in charge takes place in the hospital, and they see they visit each and every patient, they see the records, and this is during the when patient is there in the hospital. So these are the patient care centered tools. Next we have patient satisfaction measurement tool. As word indicate, patient satisfaction. This we can only ask by opinionaire, or we can if we have a questionnaire. So we use the questionnaire to the patient and their relatives or the staff. Then patient satisfaction interview. We take the interview of the patient, how they are feeling about their care, about their hospitalization. The set interview performer is there. Then RISAR patient satisfaction scale. We have scales also which is being prepared by the experts. So we use those scales just to see the patient satisfaction. And another one, nursing audit, that will be discussed in detail. But the fourth one, quality patient care scale. Here we use 2 very commonly used scales, that is Slater scale. It measures the competencies displayed by the nurse to care. And it has 84 items. And out of these 84 items, 18 actions directed towards meeting individual psychosocial needs. Another 13 items directed towards meeting group psychosocial needs. The next 13 activities to satisfy physical needs. Then 16 actions to meet general needs, and 7 actions communication items, and another 17 behavior reflecting professional expectation. So we have 84 items in this Slater scales, and we assess and we ask all the points to the patient, and then we assess the nurse and rated as best, average or poor based on these points. If she is doing, we ask the patient how she is communicating. The patient will say best, so we'll assess the nurse best. If patient will complain, no, she is not communicating with me, then we'll say poor. So very nicely the steps are written on one side and the scaling is given on right side. So this is the Slater scale, and this we do for the quality patient care. Then another scale was given by Wendelt and Egger for quality patient care. It has also the steps, but it has 68 items. 15 actions directed towards meeting individual psychosocial needs, 8 actions directed towards meeting group psychosocial needs, then 15 activities to satisfy physical needs, and 15 actions to meet general needs, and another 8 for communication items, and 7 behavior reflecting professional expectation. Again, this 68 item will be listed on one side, and the rating for the nurse, like how she is doing, the 5 marks are given. If she is doing best, then 5 marks. If patient is saying, oh, fairly she is doing, so 1, 2, 3, 4, 5, this type of rating is given in this well-dealt anger quality patient care scale. So we use these type of scale for quality patient care. So these are the tools which we use very frequently to assess our nursing care. And another some guidelines are also given. I would like to share, like given by American Nursing Association. Can we have a slide, please? The guidelines given by ANA, that be critical to specific care. Always we have to be critical, and like we have to think all the positive and the negative aspects, and we have to be specific in our care. Be relevant to many cases. Whatever tool we are using, this is the guideline given for the tool. Whatever tool we are using, it should be relevant in many cases. Be able to determine quickly. The tool 8 items, we are ticking it up, and quickly we can see the nurse is doing best or nurse is doing how she is performing. Then be possible to achieve by practitioner. The practitioner should be able to practice it. Otherwise, if it is not achievable, then how the nurse will practice it? So whatever the items are there, they should be achievable. Be clearly stated and should include positive indices of patient health. Yield a range of scores or values, as we are saying 1, 2, 3, 4, 5, poor, best, average. Then be pertinent to patient population whose care is being evaluated. Be free from bias and be appropriate to the objective, client situation, capabilities, limitations and resources. So these are the guidelines which are given by American Nursing Association to develop a tool. Because these tools we are using to assess the nurse and the health personnel. So we should follow these guidelines also.
Okay. Ms. Kora, she has already talked about the various tools and techniques in evaluating nursing care. But one of the important tools and technique of evaluating nursing care is nursing audit. Will you discuss about nursing audit in detail? What nursing audit is, what are its advantages and how it is used?
Nursing audit, when we say, it is a useful tool in evaluating the quality of care provided by any program and setting in which a record is an integral part of providing comprehensive and continuing nursing care. We can define nursing audit as nursing audit is a systematic critical analysis of the quality of clinical care. Now what do we mean by this critical care systematic analysis? Step by step, when a nurse is standing at the bedside of the patient to render care to the patient, right from that moment what she is doing, whether she is having adequate all recurred articles at the bedside, or she is leaving the patient and running to the nursing station or to the treatment room for collecting the articles. Right from that moment when we are evaluating the care and when we are keeping a track of things, that is one way of doing nursing audit. It's an official examination of nursing records for the purpose of evaluation, verification and betterment of nursing care. Now, why do we say it is recorded and we are keeping the evaluation verification for the betterment of care? Nurses' records are viewed, it may be when the patient is there with you, or it may be after the discharge of the patient. Now, sometimes when we take the nurse's record, say for example, in a recovery room, when the patient is wheeled in from the operation theatre, they may, say for example, write patient wheeled in from such and such operation theatre, whereas they are supposed to write patient had such and such surgery. They miss that major part. Instead of writing what surgery the patient had, they write patient is wheeled in from OT number 4 or OT number 5. But instead of writing patient had IM nailing or total hip replacement or whatever be the procedure what the patient underwent, they missed that part. Patient may be having normal saline on flow. They write IV on flow. They don't mention what fluid is on flow. They don't mention how much of fluid is given, or they may record the vital signs and record without writing the time. Then suppose the patient is wheeled out of the recovery room to the ward. The nurse records it as patient transferred to such and such ward. Time is not mentioned, condition of the patient is not mentioned, and how you transferred, that is not mentioned. So if such a record is taken out, you will not be able to say that the nursing care given to the patient was good. Why? In your auditing, you are not able to assess what time the patient came in to the recovery room, how much was the blood pressure of the patient at that particular given time, how much of IV fluid the patient received, what was the drain output, nothing you could make out. So in other words, in your auditing of that particular record, you say that care rendered was not up to the mark. There are certain objectives of nursing auditing. One is to study the degree of quality patient care against the defined criteria. When we say the degree of quality of patient care, we mean to say for every particular patient, the type of care what we give is also varies. When I say the type of care will be varied, a surgical patient's care will be different from that of a medical patient's care. A OB/GYN patient's care will be different from the care of a medical patient. So in every area, the type of care what we need to give is also varied. It is for justifying the cost recurred on human and material resources. In nursing audit, we see the manpower utilization, the material utilization, time utilization. Then the third objective is to take remedial action towards the cost effectiveness and improvement of nursing care. In which way we can improve the nursing care so that we can achieve the set standards. Because every auditing we go ahead to see whether we are able to achieve the set standards or not. In order to achieve this auditing as an evaluation tool, we do have certain types of auditing. One is concurrent auditing, second is retrospective auditing. These two are the main auditing measures or types we use. In concurrent, patient is there and you are evaluating. Direct observation is one method and the recording is the second thing. In the concurrent, very often we see that the patient is comfortable or not. Patient's comfort is one thing which tells us whether the patient received appropriate care or not. In retrospective, we are going through the records of the patient and we are telling whether the patient had good care. Like the example of record what I have explained, in the retrospective you will be able to see whether your patient was getting adequate care or not. Now how can we say the patient care was adequate? If you are recording the time, your procedure, the after effect of your procedure. If the patient is having a complaint, say for example, patient is complaining of severe headache. You are informing the doctor, a particular order is given, you are carrying out the order. After half an hour, how the patient is feeling, you are recording that. Now if your patient is getting discharged and going home, after 1 week or after 1 month when you take out the record, you will be able to say, yes, my patient had headache at that time, doctor ordered such a medicine, I had given and patient felt better after this many minutes. That is one way of showing that your care was of good quality.
In that situation, they may have to maintain the nurse's notes?
Yes, the nurse's records to be maintained, and nurse's records are the ones which are speaking instead of the nurse who took care of the patient. The second the type of auditing is structure audit, process audit and outcome audit. In structure audit, the way in which the particular thing is carried out, the process or the steps what you are carrying out and the outcome. As I have said about the headache, you are informing the doctor, doctor is coming and ordering. The process what you are taking up or the steps what you are taking up for relieving the headache of the patient is what is to be recorded, and the outcome of the entire process. External auditing and internal auditing is another type of auditing, but it's only the people who are doing the external auditing means outside the system or outside the hospital, somebody else is coming and reviewing what you have done. Whereas in internal auditing, within the hospital, within the department, people are doing the auditing. And when we are doing the auditing, how to do the auditing? First, we need to form auditing committee. Who all are involved in the auditing committee? The auditing committee can be the supervisors, ward in charges, the junior level staff also. Why I say junior level staff? Because they are the people who are giving direct patient care. Now, if I am giving the care, I know what I am supposed to do, and I know the basic scientific principles I should follow. And when I am there evaluating my own colleagues' care, my own colleagues' work, I will be able to say whether she is doing good care or care is not appropriate. And in such situations, the feedback what we get will be much better than the feedback of any other member. And when a colleague's work is being evaluated or audited by another colleague, the feedback will be totally different from that of what a supervisor does. The second step in this is committee should meet once in a month to audit records of patients discharged during that 1 month. And very often what happens is this may not be possible. Instead, a concurrent audit is what is carried out in many of the nursing area. Chairman would assign the number of charts each member will audit. That means if 10 members are there in the nursing auditing team, one may get 10 chart, another may get 15 chart, and say a 10 patient files may be given to a person who is doing the auditing of ICU patients, whereas a ward patient person may get 15 charts. But on the whole, when we say a retrospective auditing is less effective or less done, and a concurrent auditing is much more appreciated. And the methods of doing concurrent auditing varies from department to department and institution to institution. And visiting the unit where the auditing is to be done. As I have told already, the patient care can be audited or the individual nurse's efficiency can be audited. Both can be done. If you are giving one nurse a specific patient, and suppose the patient is developing bed sore. If the patient is getting bed sore, that speaks instead of many things, tells that the care what the patient is getting is not of quality. Or in other words, it tells you that you as a nurse is not able to render the good quality of care to your patient. And many a times as healthcare workers, we do forget that we are the people who are supposed to give, who are there to meet all the needs of our patients. And when we are preparing ourselves to give the efficient care to our patient, we are able to meet the requirements according to the patient. And then when we do the auditing outcome or the auditing report also will say, yes, this patient received the quality of care according to the need of the patient.
What is the advantages of auditing and what are the disadvantages?
advantages of nursing audit, if we say, that it gives the biographical index to quality of nursing care. You see, we are, no matter which approach we are using, concurrent or retrospective, but it gives that, it shows that how qualitatively the nurse has given care to the patient. And patient is assured of good services because we are maintaining records of it. So in nursing audit, we are maintaining record, like in the nursing process, we are following the process and we are maintaining the records of each and every procedure, and it shows, and patient is also assured that he has been given good care. And it will give valuable and pertinent information for the staff, improvement in quality of nursing, as well as strengths and weaknesses in nursing service are revealed. For example, ma'am has discussed that bed sore. Like nurse has not given the quality care, that is why the patient has developed that bed sore. So then nurse has, can assess her weaknesses from that patient, then in future she can improve. So this nursing audit helps the staff to identify the strengths and weaknesses for herself, and it will lead to better cooperation and communication among the nurse and the health team members as a result of improved quality of nursing care. Because in 3 nurse staffs are working in 3 different shifts, and we are coordinating just with the help of records. In during handing over and taking over, we are just saying that we have intake output chart is maintained, TPR chart is maintained, vitals has been taken. After that, another staff sees the records, then she follows the remaining, does the remaining work. So it leads to better cooperation and the communication. Only the thing, we have to maintain proper records, because records speaks after the staff leaves from the bedside. It will help each professional nurse for her self-evaluation, because she is assessing how much she has given to the patient and how patient is improving. So she can herself evaluate with the help of audit. Nursing audit helps the administration. How? Because if they are auditing the for the nursing care, for the better planning can be done through the nursing audit, and it enables the nursing administrator to uncover the inefficient service and point the ways to alleviate the standards. Because when we do the audit, we come to know the weaknesses, then we can guide our staff that this should not happen in future, and they have to follow these steps in future. So as an administrator, it is a very good tool to help the staff. It will reduce the incidence of medico-legal complications, because we are following the protocol, we are following the standards within our code of conduct, so it reduces the chance of legal complication. It will broaden the strengths nursing service in hospital, and it may provide data needed to effect required change in the healthcare system. So it has many advantages if we are doing this nursing audit properly.
What are some of the disadvantages of the audit?
Disadvantages, we see it is considered as a source of punishment by the professional group. They think auditing is done, we will be punished. So some people think like it is a source of punishment. Then medico-legal importance, like they feel that these will be used in court of law as any document. So they think that record should not be there, that record can be used.
Yes, that is very important. Thank you, Lakshmi, and thank you, Ms. Kora, for giving nice presentation. But what I would say is that the evaluation of nursing care is very important from the point of view of assessing the satisfaction of the clientele and assessing the satisfaction of the even administrators and the persons who are responsible for the nursing care. But what you should decide and what you should carry in your minds is that records are very important, because without the records neither we can assess the patient care nor we can have any improvements. It's only through the records and reports that we can assess the patient care and make any improvements if it is it has to be made. So I think you had a very good discussion on evaluation of nursing care, and all the nurses should maintain the records so that whenever we need auditing or whenever we need any evaluation, we use the records and make the proper judgment. Thank you very much.
Thank you.